I am pleased that we could get all of you here on another opportunity to work through the strategic planning on weather events. For those of us who either live in Birmingham or in Atlanta now, we've had an opportunity to experience either the presence or absence of integrated strategic planning. As chair of the Institute of Medicine's Committee on Post-Disaster Recovery of a Community's Public Health, Medical, and Social Services, I do want to welcome everyone to this open session of the committee's second meeting. As part of the IOM process, I am forced, under strong edict, to let you know that this is an open on-the-record information gathering session. The committee is in the process of collecting the information and materials that it will examine and discuss in the course of making its findings, conclusions, and recommendations. Therefore, I ask everyone to be mindful of the fact that the committee has made no conclusions, that it would be a mistake for anyone to leave here today thinking otherwise. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or of the National Research Council. In addition, committee members typically ask probing questions in these information gathering sessions, which may or may not be indicative of their personal views. In other words, please, everyone know that we're going to ask a whole lot of crazy questions that are allowing us to think, but no one should decide that we've already decided because of the question that we've asked. That ought to be pretty straightforward. Remember, our report will be released in January of 2015. We will deliberate thoroughly before writing its draft report. Once the draft is written, it goes through a rigorous review process by experts who are anonymous to the committee, and then the committee responds to this review with appropriate revisions. So there's a long process that goes before this final report comes out in January of 2015. We want to thank the sponsors, HHS, HUD, VA, and Robert Wood Johnson Foundation for their support. The committee was, again, asked just to center everyone and also to our guests that our task is to investigate and identify key activities and novel programs to improve the short, intermediate, and long-term health outcomes to a community recovering from a disaster and develop recommendations for the implementation. Let me just quickly ask, because we are a little late, but still want to be able to have the committee identify themselves. My name is Tuckson. I'm the managing director of a consulting company called Tuckson Health Connections.
I'm Agnes Fleshner, and I am the director of Child Welfare Services in Montgomery County, Maryland.
Good morning. I'm Daniel Aldrich, professor at Purdue University in Indiana.
Hello, I'm Steve Blessing. I'm the Chief of EMS and Preparedness for Public Health in the state of Delaware.
I'm Harry Brown. I work with United Way of Central Alabama in Birmingham.
Good morning, Bopper Deaton, George Washington University.
Good morning, Elisa Diggs, Maricopa County Department of Public Health, representing NACHO.
Hi, I'm Barry Hokinson. I'm an urban planning consultant from the Chicago area.
Linda Houston, and I do work in New Orleans, Louisiana, in public health and community change.
Good morning. Ciro Ugarte, Director of the Emergency Department of the Pan American Health Organization.
And we have a few people that are coming, but Autumn, you have to tell them who you are.
Good morning, Autumn Downey. I'm my own staff. I'm the study director for this project.
And Lauren, please.
I'm Lauren Sherman, Associate Program Officer, also staffing.
We can't even move without these people. They're so wonderful. The meeting is being recorded, and we need to let you know that the recording and available speaker presentation will be posted to the project website very shortly after the meeting. In the interest of time, the speakers will be introduced by name, title, and affiliation only, but more detailed biographies have been included in the meeting materials. And I really do have to say to all of our speakers to whom I am rudely have my back to, we really appreciate you are taking the time to help us out and for being here. And so just thank you very, very much. And with that, let me get my good friend, Erwin. I'm giving you time to get up there. Going, looks like up there by yourself, alone. as these difficult people prepare to grill you incessantly. Erwin is my friend, but more to the point today, he's from the National Center for Disaster Preparedness at Columbia, and we hope that he is going to set the stage and provide an overview of the major challenges to managing recovery following disasters and ensuring that health considerations are prioritized into decision-making. I will say that Erwin has been on the ground, and his organization has been on the ground every time, everywhere, all the time. And so their insights are hard-earned and well justified. So with that, Dr. Erwin Redlener.